Now here we are mobilising the thoracic spine. Remember from your anatomy video of a moment ago that the spinous processes of your thoracic vertebra lie down on one another like fish scales or the thatches of a roof. For that reason, a pure PA in the thoracic spine is much more uncomfortable than it need be, because it's not really getting any good separation. For that reason, I far prefer to do transverses. Now we marked out beforehand T1 and T12. You can see here there's something going on. Now this just proves again that you can often eyeball the patient and see exactly where the problem is before he even tells you. Now Cam doesn't actually even remember any incident here, but you can see how he's got a divot there, and going in here, T10 there is recessed like a piano key that won't come up. Usually the problem segment will either be recessed or it will be sitting up proud. T10 is recessed. It's also over to the right. Now Cam relates to me that he feels a click every time he side flexes to the right, and this is absolutely textbook, because to side flex to the right, that spinous process must twist on its axis and the tail must move from right to left. He won't go, and he feels a click which he finds unnerving. We want to fix that, and that's the finding that we want to work on. We can do a small amount of PA mobs, but often what we find too with thoracic spine, because it is such a tight part of the spine, we can use pressures on the ribs to actually free you up centrally, and it feels pleasant. Remember, the rib angle comes out and does this, and what we're looking for is the prominent rib, running your hand up here like running your hand up a washboard. The one that sits up proud is the problem one. We think it sits up proud because the intercostal muscles between the ribs go into spasm and sort of force it up. So we mobilise on the rib angle here to get activity here, and we can do it with the flat hand too. Now what I like you to do too when you're mobilising ribs is to not only just get a pure unilateral direction, I'm actually getting drag. I'm actually dragging the ribs off the side of the spine. Remember me telling you from the previous little video clip how heavily invested the ribs are in here? What you can do too is to move the shoulder blade out of the way by bending the arm more, because people often have trouble up here, and I can get in here much more. Now I can feel the ribs under his scapula much more, and I can feel that this one is proud. It will be sore, and again I'm using my pisiform bone there just to get that lovely pressure there. And then often we find that the rib that's proud, correspondingly the segment that it attaches to, remember it attaches to 2, is stiffer. And you can probably see there that he's stiffer from right to left here, and he's freer from left to right. Not a lot of difference there. I can see more difference up here. If I go up here, here's T1. Don't know whether you can see here that mobilising right to left is freer, left to right is much more blocked. Freer, blocked, freer, blocked. You can actually see that there's give there, much less give coming the other way. Now it's not easy being on the right side of him and mobilising from left to right. You can do it this way. You can do it this way. Again, the broader the contact with the body, the less uncomfortable it is. You can also go in here and mobilise where the rib head literally joins into the spine itself, and there it is there. So it's really very similar to just an ordinary old facet joint mobilisation. Remember too with your thoracic vertebra that I really like you to get some cephalad lift. So you try, and that's particularly important. Here on the slope down, it's easier to hook under, so you're hooking under there and you're getting separation. Remember, decompression is such an important part of the Sarah Key method. That's what you're looking for. That's what you're looking for. Then you can let that go back in again, because what I want to do is get up here. Now, all of us spending such a lot of time on the computer these days, all of us are much more hooked up here because trapezius is working overtime, bunching up the angle of his shoulder. elevating permanently your first rib. Now, lovely technique. It's very uncomfortable to push in here like this. A lovely technique is to just use this border of your index finger and just gently depress that first and second rib. You can alternate that with that and then go back again. It's a lovely technique. You do have to be careful here because the brachial plexus is nearby, and so it's easy to be very uncomfortable here and very pointy, proddy fingers, which is unpleasant. Lovely pressure and just leaning in there. So the significant finding in this back would certainly be here, T10, I would asterisk this in the notes, mobilising it from right to left where he's not happy. Left to right is empty, right to left is very different. Again, it's hard for me to get in there at the moment because he's still so recessed, so I'll try and get him out of that recession, that dip, by mobilising from right to left. There we go. There we go. How'd that feel, Cam?